Hi, this is Pam from Your Nurse Advocate Consulting. I just wanted to take a moment to share a few words from a family that we've been able to help navigate the healthcare system during a hospital stay. And so I'm very happy to have a son and a spouse here for one of our clients. And if maybe they could take a few minutes and just to let us know what exactly how an advocate can help them navigate through these through a hospital stay. So thank you
Yeah,
for joining us, gentlemen.
thank you, Pam. Well, Pam, I think it's important to notice, just to note that we've been working with you for a year, and that really helped as well, that you were able to come in when my mother unfortunately ended up in the hospital unexpectedly with a broken ankle, and then unfortunately developed pneumonia and other serious complications, and was in the hospital for 29 days, and then is still in a rehab center. What I found really, really helpful working with you, Pam, is there's a lot of emotion that goes that the family goes through in these very, very difficult situations because we didn't know where things were headed. Things were very serious, and it really helped to have a calm head that was able to think straight on our side, able to speak a language of the medical professionals, because many of them, or not many, but a lot of them don't have great social skills. And so it's difficult to ask them clarifying questions. It's also difficult to really understand the medical jargon. Pam, you were great at looking at the test results and really putting them in English for us. And we were meeting with you on pretty much a daily basis to try to keep up with things as things are moving really, really fast. So it was extremely helpful to have you on our side as we navigated all the different medical personnel that changed on a daily and sometimes hour by hour basis.
I appreciate that. And I think one of the things that to point out is when we go into the hospital, we just think that everybody knows everything, like your past medical history and things like that. And it was several times that we had to remind them of, previous medical conditions, that things weren't forgotten. And Jim, is there anything you'd like to add to that?
Yes, in the hospital, basically you catch a doctor of specialty as they come through. It's tough to catch the individual doctor, but and they rotate shifts, so it was very helpful for us to have Pam with us, either by speaker or FaceTime. We met with the doctors, and I think they really appreciated Pam's input. Uh, Helping us understand what was going on. So I really appreciated that. And for us being lay people, we don't understand everything that's going on. And, you get burnt out after a while just dealing with this. So I really appreciate Pam's help in communicating what was going on to us. Thank you.
No, you're very welcome. And just any last thoughts before we wrap it up?
Yeah, I can't reiterate that enough. What my dad just mentioned, just in the communication and how much slips between the cracks in the medical. There are fantastic people in the medical profession. The way they do it and all the rotations and everything, and having to retrain people, it was exhausting.
Yeah, I think one of the things too that, and your mom and your wife had a complicated stay, and just with all the specialties involved, just reminding the staff what was going on with the other specialties and just trying to keep the balls in the air and the pieces in the puzzle, because all the doctors were focused on their lane. They were focused on their specialty and often forgot what was going on, with the other specialties. So I was grateful that I could help keep, like I said, all those balls in the air. So, well, just want to say, I want to thank you both for sharing your thoughts and letting us know that that you appreciate what we did. We greatly appreciate that. And again, any last words before we end?
No, just
Okay.
thank you so much.
Well,
No, thank you very much for all the help you've given us.
it's very appreciated. Thank you.
Thank you.